Pelvic inflammatory disease, also known as pelvic inflammatory disorder (PID), is an infection of the upper part of the female reproductive system, namely the uterus, fallopian tubes, and ovaries, and inside of the pelvis. 5. Often, there may be no symptoms. 1. Signs and symptoms, when present, may include lower abdominal pain, vaginal discharge, fever, burning with urination, pain with sex, bleeding after sex, or irregular menstruation. 1. Untreated PID can result in long-term complications including infertility, ectopic pregnancy, chronic pelvic pain, and cancer. 2, 3, 4. The disease is caused by bacteria that spread from the vagina and cervix. 5. Infections by Neisseria gonorrhoeae or Chlamydia trachomatis are present in 75 to 90% of cases. 2. Often, multiple different bacteria are involved. 2. Without treatment, about 10% of those with a chlamydial infection and 40% of those with a gonorrhea infection will develop PID. 2. 9. Risk factors are generally similar to those of sexually transmitted infections and include a high number of sexual partners and drug use. 2. Vaginal douching may also increase the risk. 2. The diagnosis is typically based on the presenting signs and symptoms. 2. It is recommended that the disease be considered in all women of childbearing age who have lower abdominal pain. 2. A definitive diagnosis of PID is made by finding pus involving the fallopian tubes during surgery. 2. Ultrasound may also be useful in diagnosis. 2. Efforts to prevent the disease include not having sex or having few sexual partners and using condoms. 6. Screening women at risk for chlamydial infection followed by treatment decreases the risk of PID. 10. If the diagnosis is suspected, treatment is typically advised. 2. Treating a woman's sexual partners should also occur. 10. In those with mild or moderate symptoms, a single injection of the antibiotic ceftriaxone along with 2 weeks of doxycycline and possibly metronidazole by mouth is recommended. 7. For those who do not improve after 3 days or who have severe disease, intravenous antibiotics should be used. 7. Globally, about 106 million cases of chlamydia and 106 million cases of gonorrhea occurred in 2008. 9. The number of cases of PID, however, is not clear. 8. It is estimated to affect about 1.5% of young women yearly. 8. In the United States, PID is estimated to affect about 1 million people each year. 11. A type of intrauterine device (IUD) known as the Douching shield led to increased rates of PID in the 1970s. 2. Current IUDs are not associated with this problem after the first month. Cause Chlamydia trachomatis and Neisseria gonorrhoeae are usually the main cause of PID. Data suggest that PID is often polymicrobial. 14. Isolated anaerobes and facultative microorganisms have been obtained from the upper genital tract. Gonorrhoeae has been isolated from fallopian tubes. Facultative and anaerobic organisms were recovered from endometrial tissues. 17. 18. The anatomical structure of the internal organs and tissues of the female reproductive tract provides a pathway for pathogens to ascend from the vagina to the pelvic cavity through the infundibulum. The disturbance of the naturally occurring vaginal microbiota associated with bacterial vaginosis increases the risk of PID. 17. Gonorrhea and C. trachomatis are the most common organisms. The least common were infections caused exclusively by anaerobes and facultative organisms. Anaerobes and facultative bacteria were also isolated from 50% of the patients from whom chlamydia and Neisseria were recovered, thus anaerobes and facultative bacteria were present in the upper genital tract of nearly 2/3 of the PID patients. 17. PCR and serological tests have associated extremely fastidious organism with endometritis, PID, and tubal factor infertility. Microorganisms associated with PID are listed below. 17. Rarely cases of PID have developed in people who have stated they have never had sex. 19.